Being able to treat your school teachers who traveled the distance to come and see you and diagnose their problem and treat them and help them overcome the problems that they were having is something that I consider extremely special, satisfying, gratifying.
The first one, prostate problems only happens to men over 60.
Myth, because prostatitis can happen in younger men. BPH can set in at the age of 45, 50.
So
And even
60 is
prostate
not the time.
cancer can be diagnosed in the 40s and 50s. Early stage prostate cancer or slow growing prostate cancers could have a normal PSA. So when it comes to prostate health, men often tend to dismiss or ignore early signs and symptoms. By and large, difficulty in urinating up too often at night, to strain, not really being able to empty the bladder completely, frequent infections
Achha.
are some of the red flags which one must stop. Any symptom that lasts for more than 2 to 3 weeks needs to be reported to your family care physician, and then he can guide you for further tests.
Behind every prostate diagnosis is a man silently carrying fear, uncertainty, and the weight of unspoken questions. It's not just a health issue, it's about identity, dignity, and the quiet battles fought in doctor offices and sleepless nights. For many, the hardest part isn't the treatment, it's starting the conversation. Joining us today is a celebrated expert in the fields of urology, Dr. Ketan Pai. With an impressive journey that began at BV Medical College and advanced through premier institutions like KEM and Tata Memorial Hospitals, Dr. Pai brings over 2 decades of deep expertise in general surgery, genitourinary surgery, uro-oncology, and kidney transplantation. Known for his expertise ranging from kidney transplant procedures to non-invasive and minimally invasive techniques, from scarless surgeries to cutting-edge urological and transplant care, Dr. Pai's commitment to excellence ensures that every patient receives the highest standard of treatment. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Ketan Pai. Sir, how are you? Welcome on today's podcast.
Hi Tushita, thank you for having me over. I'm feeling great today and happy to be part of this podcast today.
We are very happy to have you here because today we are going to talk about prostates. I think it's one of the topics which is very common these days, but a very little is spoken about it. So before I, dwell into this, I wanted to ask you this: 2 decades of experience, 20 plus years. You always wanted to be a urologist?
Well, I wanted to be a surgeon for sure.
Acha.
And during your surgical training, you get influenced and inspired by the people who train you.
So who was your inspiration?
So my inspiration has been a gentleman by the name Dr. Deepak Kirpekar,
Acha.
one of the very senior most urologists of our country. And I've known him since my childhood because he happens to be a very good friend of my father.
Acha.
And he left a lasting impression on my mind, which made me pick up urology as a specialty.
And 20 years. So how has this journey been?
So the journey has been exciting, fascinating, and with the newer advances of technology, it has become even more exciting as the years go by. So it's been a wonderful journey, and I remember him telling me that if you love what you do, you do not have to work a single day in your life. And that's why I love what I do, and so I don't consider it to be work.
So, sir, you're the face of urology when it comes to, the Department of Urology. So, have you accepted it wholeheartedly, or you
absolutely.
still don't
No, I
believe
have
it?
accepted it wholeheartedly and I enjoy every moment of it.
Every moment of it. So, without any further ado, we'll start with today's topic. So, prostate, as we speak about, right? So, let's start with something very basic where we talk about
sure.
the red flags about prostate. Can you help us understand what are the red flags about prostate?
So when it comes to prostate health, men often tend to dismiss or ignore early signs and symptoms, assuming them to be part of normal aging process.
Achha.
So in case men are more vigilant, better informed, and can pick up these signs and symptoms early on, it can help making an accurate diagnosis and offering the right treatment. By and large, difficulty in urinating, waking up too often at night, needing to strain, not really being able to empty the bladder completely, having frequent infections are some of the red flags which one must observe. Any symptom that lasts for more than 2 to 3 weeks needs to be reported to your family care physician, and then he can guide you for further tests.
So when we talk about the tests, right, this PSA, how reliable is it and how important is it and who should get it done?
So PSA stands for prostate specific antigen. It is a protein that is secreted by both normal and abnormal cells of the prostate. A rise in PSA could be due to a different kind of situations. PSA stands for prostate specific antigen. It is a protein that is secreted by both normal and abnormal prostate cells. It is a simple blood test that can be carried out at any standardized lab. PSA is organ specific but not disease specific. What I mean by that is that PSA is specific for the prostate gland but not specific as to what disease of the prostate gland. So PSA can rise with infections, with age, with an enlarged prostate, with prostatitis, and also in malignancy. So you need to clearly interpret this rise in PSA before you label the patient with a particular problem.
So, sir, is there any particular age group that you recommend who should get a PSA done annually, or how is it?
So, by and large, PSA screening starts after the age of 50. Unless you have a high risk of prostate cancer. By that, I mean you have either a family history of father or your brother or an uncle who's had prostate cancer before the age of 65. This subset of patients are actually a high risk subset, and in them a PSA screening can start at the age of 40 or even 45.
So, sir, as you spoke about the different conditions in prostate, so what is the difference between BPH, prostatitis and prostate cancer, and how can a man identify or differentiate between all this?
So BPH stands for benign enlargement of prostate, which is age related, commonly seen in men after the age of 50 and 60. It is associated with all the symptoms that I just told you. Prostatitis involves infection or inflammation of the prostate, would have similar symptoms like BPH, but these patients would also have pain, burning, fever, and so on and so forth. Malignancy of prostate or cancer prostate is cancerous involvement of the prostate, which usually happens in elderly males, but can also occur in the 40s and 50s. So early stage prostate cancer may be asymptomatic, or they could have symptoms like BPH. But as the disease progresses, the patients get symptomatic. Very often, by the time they are diagnosed, they have advanced symptoms.
So, sir, prostate, usually in the cases where it requires a surgery, what role has robotics played in this?
So, robotic surgery has been a game changer with regards to prostate cancer treatment. Especially in early prostate cancer disease, robotic surgery has transformed the way prostate cancer treatment is done, and it is considered today the standard of care for early prostate cancer. It is a minimally invasive procedure with very high precision, offering 360-degree range of movement to the instruments within the body. It eliminates the tremors, and there is an extremely good quality, high definition, three-dimensional vision. So in today's days and age, for early prostate cancer, robotic surgery is the standard of care.
So tell us about this testosterone replacement therapy. What is it all about?
So testosterone replacement therapy is an extremely debated topic when it comes to prostate health. In middle-aged and elderly men, there is a situation where some men may suffer from low testosterone levels. This situation is called as androgen deficiency of the aging male or ADAM. Such patients would suffer from symptoms like fatigue, tiredness, low sex drive, decreased libido, and erectile dysfunction,
Okay.
eventually leading to decrease in muscle mass. They are benefited with testosterone replacement. The age-old concept was testosterone replacement can stimulate hidden or dormant prostate cancer cells, and patients could end up developing prostate cancer.
Acha.
However, studies and research has proved that in a patient without prostate cancer, testosterone replacement does not increase the risk of prostate cancer.
Acha.
So it can be safely used in patients with low testosterone levels.
Okay. So when it comes to the multiparametric MRI in prostate cancer detection, what are your thoughts on that?
So multiparametric MRI of the prostate, or MPMRI, is an extremely useful tool in diagnosing, staging, and monitoring prostate cancer.
Acha.
In patients with elevated PSA, a multiparametric MRI can identify the suspicious areas within the prostate
Okay.
and help our radiologist target those lesions which improve the yield of a prostate biopsy.
Acha.
At the same time, it will also prevent unnecessary biopsies in patients who have a marginally elevated PSA but a normal MRI.
So, sir, is there still a place for digital rectal examination in the age of PSA imaging?
So digital rectal examination is an age-old test, which
Acha.
is a manual bedside test
Okay.
where a lubricated gloved finger is inserted into the rectum to feel the prostate, look for the size, texture, look for any abnormalities within the prostate, like any nodules or asymmetry. It is extremely helpful and does help us giving an idea about the prostate health.
Okay.
There's an age-old saying which says that if you do not put your finger in first, you'll end up putting your foot in later.
Oh my God. That's quite scary. So when it comes to the genomic biomarkers, so how does it influence the treatment of prostate?
So genomic biomarkers are basically analyze the gene expression patterns within the prostate cancer.
Acha.
It helps in prognosticating the prostate cancer. It helps telling us whether a particular cancer is likely to metastasize,
Okay.
likely to recur,
Acha.
and thus helps us tailoring a treatment protocol for a particular patient.
So what are the current indications of robotic assisted prostatectomy versus the traditional or the open procedures which we used to do?
The choice of open, laparoscopic, or robotic prostatectomy depends upon the stage and extent of the disease,
Acha.
the patient's health,
Acha.
the surgeon's experience, and the hospital infrastructure with regards to robotic availability.
Okay.
In case it is available and indicated, robotic radical prostatectomy today is the gold standard or the standard of care for early prostate cancer treatment.
So, sir, moving on to the next section of our podcast, I'll quickly read out a few lines. You have to, we call this as mythbusters. So, the first one, prostate problems only happens to men over 60. Myth or fact?
Myth, because prostatitis can happen in younger men. BPH can set in at the age of 45, 50.
So
And even
60 is not the
prostate
time.
cancer can be diagnosed in the 40s and 50s. Yes, it is more frequent beyond 60, but can happen even in the 40s and 50s.
Sure. A normal PSA test means you are in the clear.
Again, a myth, because early stage prostate cancer or slow growing prostate cancers could have a normal PSA.
Oh, is it?
A varied histology of prostate cancer could have a normal PSA.
That's right.
And at the same time, an elevated prostate PSA need not mean cancer.
Acha, okay. Prostate cancers are always aggressive.
Again, a myth,
Okay.
because slow growing, indolent tumors could remain quiet for a long period of time and may not alter the overall lifespan of a patient. So not all prostate cancers are aggressive. However, they need to be evaluated. You need to be assessed properly, and then you need to be told whether this is aggressive or it is indolent.
Okay, so moving on to the next one. Urinary symptoms in men are always due to prostate.
Again, a myth. because urinary symptoms in men are not always due to prostate, as urinary tract infections, bladder stones,
Acha.
long-term diabetes, and certain neurological conditions like Parkinson's disease, multiple sclerosis,
Acha.
or an old stroke
So all these
can also lead to urinary
urinary
symptoms.
infections. Okay. Vegan or plant-based diets protect the prostate.
Partly true,
Okay.
because vegan or plant-based diets, due to their high antioxidant and anti-inflammatory properties,
Okay.
are extremely healthy.
Okay.
They do help us in maintaining good health. From that point of view, they are healthy. But to say that they are foolproof against prostate cancer
That
is
won't be
not
right.
entirely true.
Okay. All prostate issues cause painful urination.
Not really, because again, a myth, because benign enlargement of prostate can be a quiet disease. Patients gradually tend to have symptoms, gradually the symptoms worsen, and they could affect the quality of life, but not necessarily lead to pain.
Okay. I'm very sure the next one, you're tired of hearing this. Once diagnosed with prostate cancer, surgery is the only option.
Completely a myth, because there are multiple other methods of treatment of prostate cancer.
But you hear that frequently?
Yes, we do hear this question frequently. Prostate cancer treatment depends upon, as I said, the grade and stage of the tumor,
Correct.
the age of the patient,
Yes.
comorbidities, and whatever treatment one can offer. So, surgery, yes, is indicated in early prostate cancers. Radiation also can be offered in elderly patients with similar efficacy as surgery for early prostate cancer. But in advanced prostate cancer or metastatic prostate cancer, hormonal therapy, which can either be offered in the form of injections or a small surgery, is the treatment that is desirable.
Okay.
Also, in hormone refractory prostate cancer, chemotherapy is indicated. So there are multiple modalities to treat prostate
so surgery
cancer.
Is not
Surgery
the
is
only
not
option.
the only option.
Okay. Prostate surgery always leads to impotence and incontinence.
So when we talk about prostate surgery, it could either be for benign enlargement or cancer of the prostate.
Correct.
So treatments for benign enlargement are medications or endoscopic prostate surgery, and we rarely come across patients with incontinence and impotence after this. However, when we treat cancer of the prostate surgically, there are chances of impotency and incontinence in the early period, but with better technology, with enhanced surgical experience, and with the use of the robotic platform, both incontinence and impotency does recover within a few months.
Achha. Okay. If there is no family history, you are not at risk.
So having a family history definitely puts you at an added
Greater
risk.
Yes.
But most patients diagnosed with prostate cancer do not have a family history.
Achha.
So no family history does not make you clear from prostate cancer. But at the same time, having a family history makes you more susceptible to developing prostate malignancy.
Moving on to the next segment, which is rapid fire. A quick, one-word answers, if you can. Can too much cycling really harm your prostate?
That's an interesting question. So, what is too much is important. So, moderate level of cycling up to about 15 to 20 kilometers, I think, is healthy. It is a good form of cardio exercise. It helps you maintaining optimum weight, and I hardly see any side effects from it.
Okay.
However, if one were to do long distance cycling, as in 80 to 100 kilometers or more than that, on a regular basis, we do get at times patients complaining from chronic pelvic pain, tingling numbness in the perineal region. And in such situations, it is important that you meet your urologist or physician and try and see what the problem is.
Sure. Does frequent ejaculation lower your risk of prostate cancer?
I wish so, but that's not entirely true, because theoretically speaking, ejaculation leads to emptying of the prostatic secretions, thereby reducing the inflammation and the chances of infection, and so leading to a lesser chance of prostate cancer. But there is no cause and effect relationship that frequent ejaculation will prevent development of prostate cancer.
Sure. Why do so many men ignore prostate symptoms until it's too late?
Well, I would say fear, stigma, and misinformation. Fear of disease,
Correct.
stigma of discussing these issues with family members,
Mm-hmm.
and misinformation that this is part of
Of
natural aging
aging, yes. I think
are
that's
the reasons why patients delay seeing a doctor or a
seeing a
physician.
doctor. Correct. Is an enlarged prostate a normal part of aging or can it be prevented?
So, enlarged prostate
It's
is a normal part of aging,
mm-hmm.
and it does happen as the years go by.
Mm-hmm.
But not every patient with an enlarged prostate will have symptoms.
Symptoms.
Also, we cannot prevent enlargement of the prostate.
Because it's an aging process.
It's an aging process.
Can diet actually shrink your prostate?
I don't think diet can actually shrink your prostate,
Mhm.
but we have different medications which are used for benign enlargement of prostate, which definitely can shrink the prostate to some extent.
Okay. What's the silent killer? Reputation of prostate cancer really about?
So, as I mentioned to you, early prostate cancer patients could be asymptomatic
Mm-hmm.
or could have symptoms similar to patients with benign enlargement of prostate.
Okay.
Hence, these symptoms tend to get ignored
Mm-hmm.
and patients continue with their day-to-day life.
Okay.
It is only when the disease progresses and the patients become symptomatic do we realize that the disease has progressed, and hence it is called the silent killer.
Okay. If you live long enough, you'll get a prostate cancer. How true is that statement?
Not entirely true, because prostate cancer is more common with advancing age,
Answer?
but that necessarily does not mean that every old man will
Will
have
have a
prostate
prostate
cancer.
cancer. Can prostate issues affect your sex life and can that be reversed?
Yes, so prostatic issues can lead to a change in your sex life. It could lead to erectile dysfunction. It could lead to certain ejaculatory issues. So when we treat this, we treat the prostatic issues separately and we treat the erectile dysfunction separately. For treating prostate-related symptoms, we either offer them medication or endoscopic surgery based on the findings. With regards to the erectile dysfunction, we have medications like sildenafil and tadalafil. We have different other modalities like penile injections, vacuum devices, penile implants, which can help patients overcome erectile dysfunction.
Okay. So if you have to give a message to people who are recently diagnosed with, prostate enlargement or any other conditions of prostate, what would that message be?
Well, my message would be that you need to see a urologist. You need to see someone who can identify the problem, get the relevant tests done, rule out prostate cancer, offer you a treatment that is most advisable and recommended for you, and stay in a regular follow-up. I would also like to emphasize that every patient with enlarged prostate need not require surgery.
Acha?
Today, 40% of patients can be treated purely on medication.
Uh-huh.
And in the remaining 60%, endoscopic treatment can be offered, which has very good outcomes and can improve your quality of life.
Sure, sir. So before we let you go, share one case with us which is very close to your heart and which has made you feel really good.
So, well, being able to treat your school teachers who traveled the distance to come and see you and diagnose their problem and treat them and help them overcome the problems that they were having is something that I consider extremely special, satisfying, gratifying, and really gives me that sense of happiness that one does not get in the day-to-day life or the running arounds that we do.
So you work relentlessly, tirelessly. I don't know how many hours in a day you work. What keeps you motivated? What keeps you going forward?
As I told you, if you love what you do, you do not consider this to be work. So I've been fascinated with this specialty of urology, and I tend to improve upon myself on a year-to-year basis. So that helps us learn new things, unlearn some old practices, and we try and aim to improve upon what we've been doing. So this is something that keeps us going, that keeps us motivated, and makes me happy.
On that note, we wish you all the best for all the future endeavors.
Thank-
Many more patients who need you and are waiting for you. We wish you all the best. And thank you once again for coming on today's podcast, speaking about, the most burning topic, one of the topics which was prostate. Thank you so much, sir.
Thank you, Tushita.
Thank
Thank
you.
you.